Good evening for and on behalf of the Philippines Department of Health, East Avenue Medical Center. Thank you to the Healthcare Asia Award for this recognition. This award celebrates a bold step forward in public health through the Philippines Department of Health, East Avenue Medical Center's Ambulatory Care Surgery Center, a transformative initiative that redefines how surgical care is delivered in a government hospital. Through this model, we have reduced waiting times, improved access, and ensured safer, more efficient care for the patients who need it most. This recognition embodies the hardworking human health resources of the East Avenue Medical Center's dedication, commitment to provide accessible, better outcome and less financial risk for our patients. We would also like to recognize the team lead, Dr. Glomar Morana, whose vision and commitment made this innovation possible, and our dedicated team who brought it to life. This honor humbles and inspires us to continue building a more accessible and patient-centered healthcare system. Thank you very much, and to God be all the praises and glory. The East Avenue Medical Center Ambulatory Care Surgery Center has significantly improved both how quickly patients receive their procedures and who can access services, especially those who are typically overlooked. First, we moved a large portion of elective cases out of the crowded main operating rooms and into a dedicated day surgery hub with its own modern operating rooms, recovery area, and extended weekday hours from 7 a.m. to 8 p.m. By prioritizing clean elective surgeries like hepatobiliary breast and hernia procedures, we freed up inpatient operating room time for emergencies and provided elective patients with a predictable schedule instead of being bumped by urgent cases. Previously, only about 22% of wait-listed elective patients could receive surgery each month. So this change directly addresses that backlog and the long delays that previously led to patients being admitted as emergencies. Second, we address the invisible delays in the system. We redesigned the workflow into a one-stop process. Referrals go directly to the Ambulatory Care Surgery Center, social services, insurance, preoperative assessment, and scheduling are handled in a single streamlined pathway, and the same team manages surgery and discharge. This reduces time wasted switching between departments, speeds up decision-making, and enables smoother same-day discharge. So each slot we open results in actual completed surgery. Finally, we were very intentional about providing access for low-income patients. The center is located within a 1,000-bed government hospital that serves nearly 3 million residents, many from which belong to the low-income families, and is fully integrated with our social services, diagnostics, and critical care units. By performing these surgeries in a lower-cost outpatient setting, aligning with PhilHealth packages, and offering zero-balance billing for indigent patients, we eliminate out-of-pocket costs that often cause people to delay or skip surgery altogether. The result is not only shorter wait times, but also timely, affordable surgery. Patients who previously had to wait, worsen, or only reach us in emergencies. The outpatient surgery model improves the efficiency of the public system by enabling us to perform more surgeries with the same or fewer resources. In our case, relocating suitable elective cases to a dedicated ambulatory surgery center freed up congested inpatients' operating rooms and beds that were previously used for patients who did not actually need an overnight stay. Instead of competing with emergencies, day surgery patients now follow a separate, streamlined pathway which decreases cancellations, shortens waiting time, and allows us to increase surgical volume over 240 operating days a year. This kind of capacity gain is essential in a system where only about 22% of wait-listed elective patients used to receive surgery in a given month. Efficiency also stems from how we organize work. We implement standardized clinical pathways, dedicated outpatient trained teams, and a one-stop pre-operative process so that referrals, assessments, authorizations, and scheduling are managed in a coordinated manner. This reduces delays between steps, eliminates unnecessary admissions, and supports safe same-day discharge, which in turn lowers length of stay and enhances patient flow throughout the hospital. Thirdly, the outpatient model is financially efficient at the system level. Day surgery cases use fewer resources than inpatient procedures, no ward beds, less ancillary care, and at our center, this results in operating margins increasing from about 31% to over 57% within the first 4 years, with a payback period of less than 5 years for the initial investment. Since we are integrated into a government hospital and aligned with PhilHealth, these efficiency gains not only improve the hospital's finances, but also enable us to maintain zero balance billing for indigent patients while expanding services. We knew that to attain higher utilization and predictable schedules, we need to redesign both our work processes and how we monitor performance. Operationally, the big shift was creating a dedicated day surgery engine instead of simply adding more cases to the old inpatient queue. We operate 2 main operating rooms on 240 weekdays a year with extended hours, and we reserve this list for clean elective cases. This case selection, along with a separate Ambulatory Care Surgical Center pathway, allows us to steadily increase the volume of day surgery cases over 4 years without interruption from emergency admissions. We also changed the micro-level workflow. Referrals now go straight to the Ambulatory Care Surgery Center and are handled through a one-stop process. Social service, PhilHealth, and financial clearances, including pre-op assessment, patient education, scheduling, and discharges are all coordinated by one multidisciplinary team using standard clinical pathways. This reduces no-shows and day of surgery cancellations, and it allows us to structure our list of procedure type and expected duration, which is key to achieving high utilization of operating room time. Also, we treated financially viability as a design requirement, not as an afterthought. We deliberately integrated the center into the main government hospital so we could leverage existing consultants and residents, keep the dedicated ACSC staff lean, and align our case mix with PhilHealth reimbursement level. Combined with careful cost control, this produces operating margins rising from about 31% to over 57% and net margins above 50% within the first 4 years, with the roughly 54 to 64 million peso capital investment payback in under 5 years. Those numbers give us the confidence to keep scaling while maintaining zero balance billing for indigent patients. For us at East Avenue Medical Center, winning the Outpatient Service Initiative of the Year truly affirms that a government hospital can provide world-class day surgery for ordinary Filipinos, not just for those in the private sector. It shows that in a 1,000-bed public hospital such as ours, serving nearly 3 million mostly low-income residents, we were able to turn a long-standing problem, that of only 22% of wait-listed elective patients getting surgery each month, into a real solution through a dedicated ambulatory surgery center. It also gives us a strong mandate for what comes next. The award strengthens the case for expanding beyond general and thoracic cardiovascular surgery into orthopedics, urology, gynecology, dental, and plastic surgery, while scaling our projected volume from around 2,400 to almost 3,800 day surgery cases over the next few years. It supports investment in electronic health records, integrated analytics, and even clinical research so that the ACSC becomes not just a service, but a platform for innovation in the public sector. Most importantly, It provides the East Avenue Medical Center as a template that other Department of Health and local government unit hospitals can adopt. So the impact of this model goes far beyond our catchment area. It truly encapsulates the motto of the East Avenue Medical Center of going beyond.